Here at 11th Street, I learned how to save my own life. I remember I couldn't even walk up a flight of steps. Without it, I think I would be probably in a hospital somewhere or just a forgotten person in the community.
11th Street is a community-based healthcare center in my neighborhood.
11th Street is not just a clinic. It's a health hub that sits in the middle of 4 public housing developments in North Philadelphia and serves what essentially was a medically underserved community.
I've been there several times, and to see the work that they're doing to provide not only basic health care to residents who need that kind of health care and normally don't have access to it, but also the kind of care and concern and life skills in addition that are provided.
General clinics are more task-oriented, and people come in, they're sent home very quickly from hospitals, and that's not the feeling that I get here at all. People are cared for here and given special attention here.
Transdisciplinary teaches us how to talk to each other, and the patient does better by having better communication.
But along with the primary health care, we provide all kinds of integrative health.
Psychiatrists, psychologists,
cooking classes,
the pharmacy,
parenting classes,
yoga, reflexology, Reiki, fitness center,
pregnancy classes,
behavioral health therapists,
music therapy, dance therapy, and art therapy,
a variety of outreach.
To not only have a first-class medical facility, but also have an excellent dental program.
And Farm to Families, which provides healthy food access for our low-income patients.
It recognizes that the patient and their families are really the primary caretakers, and we're there to help guide them through treatment decisions. We look at the patient and family and their individual circumstances.
My success stories have been with patients who have lost weight because we've dealt not only with the food choices, but also what's behind the choices that they're making and why are they making those choices. And a lot of them are depressed and, have lost jobs and, are just really have a lot of other things going on at home that makes food and their health, at the bottom of their priority list.
We learn from the patients what their needs are, who they really are, what are the core issues they're working from, and we build treatment accordingly.
I think the 11th Street Family Health Service is a great clinical opportunity for students from many disciplines. We have students from nursing, creative arts therapy.
Working here at 11th Street as an intern was just a life-changing experience.
Our students at Drexel in the physical therapy program spend their first year, they have a class each quarter that gets them out into the clinic. So there are several rotations, of which 11th Street is one of them.
One of the best opportunities I think our students have is our intensive care management program.
Nursing students come here from Drexel University. I take them to one of these people's homes, and they see a realistic, non-sterile environment where patients live and the troubles that they deal with there, the problems that they deal with there. And it's quite eye-opening.
And when students are caring for patients in the hospital, it's a very different environment. So I always say to the students, it's a real honor to be able to go into somebody's home, to meet with them there on their level.
They see a way that care can be delivered and that they'll appreciate this and be change agents when they graduate and they're working. So I think it's an invaluable experience for students.
This area doesn't have the reputation that it used to have. And since they tore down the original Richard Allen and put the houses here, so that this center being here has brought something to the community that was needed. To not have this center here would devastate the neighborhood and leave the neighborhood to go back to what it was when it was considered the dope capital.
Initially, I had a full-time job. When I got laid off, I was older, and I didn't have those resources anymore, and I didn't have access to health care. And one of my coworkers said, well, do you know about the 11th Street Center? And I called, and it's been magic ever since.
With my last baby, I was diagnosed with gestational diabetes. They taught me a lot about my diet and how to control it. I've never experienced it before. It was something new. I was terrified at first, but this health center got me through it. And I have a healthy baby. You know, I went through labor with no problems, and I thought that if I didn't have the support from 11th Street, I don't know what I would be doing right now. So I'm thankful.
It's a very close working relationship. One of our guiding principles is that all our care is based on community-defined need.
We thought this was going to be everything we'd ever need. Never anticipated the success and the growth that was going to take place. So when we opened, there were about 5 or 6 of us working there in 17,000 square feet with space that we weren't even using. Now, 10 years later, there's between 55 and 60 people working in that same 17,000 square feet.
So it's not just what happens within the center, but also what happens in the community.
I think that's what is so important working with our patients, is that being centered and being right in the middle of it really helps them sort of focus on themselves for a moment and reduce one more barrier of like getting to their appointments.
I can walk here to get my dental work. I could bring my son here. You know, Malik has been coming here since he was about 8 years old. He's 18 now.
The Youth Advisory Board is working with the John F. Street Center, and pretty much we're helping them figure out programs and activities for kids through middle school and high school, so they can go somewhere after school to stay out of trouble if they're not involved in sports. And if they are involved in sports, we also offer like leagues and stuff like that to keep kids active.
The work that we've done with the teens here at the health center has really opened up their perspective to the potential in their voice and their story. Through tangible projects that they could put their hands around, that they could grasp, they began to open up about where they really saw their futures going.
We don't work for the patients, we work with the patients. Like, that's really important. That's the heart of 11th Street.
Certainly 11th Street has been a success. It's become a national model of care, but we've outgrown our space. I share my office with 2 other people. We had 30,000 clinical visits last year in that very small space. Certainly, we need more space, not just to accommodate more people who want this care, and we are no longer doing outreach to bring people in because we're at capacity. People hear about us by word of mouth, and they come, and we're trying not to turn people away.
So as a result, they're a victim of their own success. As a result of that, everybody wants to come to 11th Street Clinic.
You know, it's given me the opportunity to see what a difference that you can make in someone's life and what a difference that patients have made in mine.
The individuals that come in here to take care of themselves show up in a way that I never really could have imagined people showing up to care about themselves. And they do it every day, and they do it wholeheartedly. And it keeps me coming back inspired and excited about the direction healthcare is going.
This is really something that needs to be spread throughout not just Philadelphia, but through the region and perhaps in the country, because it's the wave of healthcare for the future, saving money. It saves lots and lots of millions of dollars for our healthcare system and our taxpayers.
It has a ripple effect. Kids who are treated there are in school more. Folks who are employed are at work more. Folks who are feeling good physically and mentally cost the healthcare system less, which impacts us all.
If you find a model that works, if you find a model that's successful, it just makes good business sense and good common sense to expand that model. That's why at Wells Fargo we support 11th Street, and that's why we advocate for the expansion of services in years to come.
Over the 10 years that this building has been here, and even the couple years before, 11th Street has built such trust in the community that the community really sees it as vital.
When you've got a successful product and people want the services you provide, I would argue that that is the best investment a philanthropist or anyone in our community can make.
And we look to people who will help fund the expansion. But in addition, contribution to the expansion of 11th Street will not just help those people immediately served by 11th Street, but because we are serving as a transformative model for this country, supporting the expansion of 11th Street is supporting the change in healthcare that we all need in this country. Certainly, anyone who's thinking about giving money has their own personal stories and understand the hardships that happen in families of any income level.
I mean,
Come on, these programs are meant to save people's lives. Save my life.
To learn more about 11th Street, please contact the Drexel College of Nursing and Health Professions, Office of Institutional Advancement at 215-762-2041.